pad, which is important. Here we go.
Hello, everybody. I'm Akshat Agarwal, and I'm a research fellow and co-director of the Samvidhaan Fellowship at the Vidhi Center for Legal Policy. I would like to welcome you all to day 2 of the Samvidhaan Summit, which is a series of public conversations and discussions on legal and policy issues and constitutional law. Today, we are delighted to have Dr. Louise Tillin with us for a masterclass on India's COVID-19 response and federalism. Dr. Tillin is the director of King's India Institute and reader in politics at the King's College London. She's one of the leading scholars on Indian federalism, and her research interests span federalism, democracy, territorial politics in India, and the history and politics of social policy design and implementation. She's authored several textbooks, including Oxford Short Introduction to Indian Federalism and Remapping India, New States and Their Regional Origins. She's the editor of the Journal of Regional and Federal Studies and is long considered an expert on Indian federalism. We are delighted to have Dr. Tillin with us today. And welcome, Dr. Tillin.
Thank you very much.
The format for today's session is, first we'll start with a presentation by Dr. Tillin, where she will talk about her work on Decov India, which is a portal that King's College has started recently on India's COVID response, post which I will come in as a discussant and we'll have a short Q&A, and we'll also take questions from the audience after that. But if you have any questions regarding the presentation for Dr. Tillin, please keep sending them in the Q&A box, and we'll take them together at the end of the session. So Dr. Tillin, we can start the presentation now.
Thank you very much, and thank you, Akshat, for that warm welcome. It's a real pleasure for me to be here talking today. I should say, and I was just saying to Akshat before we started, in some ways these Zoom webinars don't allow us to have the more intimate conversations that we would manage if we were doing this in person. And for me, that's something of a regret. So I really would encourage you to take up Akshat's offer or invitation to post your questions or comments in the Q&A or the chat function as we go, because for me, I would like this to be an opportunity for me to learn as well and to listen to all of you. Obviously, with the pandemic, with travel restrictions being what they are, I'm talking to you from London, so I am observing India's response to COVID-19 and the federal dimensions of that from a distance. And I'm sure many of you who are here on the call today are observing them much closer up than me. So I am really open to hearing your thoughts, your reflections on the response to the pandemic from the perspective of federalism and from the perspective of both India's state governments, but also its central government. And what I'm going to do today in the first part of this talk is to talk rather broadly about how we might situate the response, which is still evolving, of course, to the pandemic, from the perspective of federalism. I'm then going to just introduce briefly our Decov India project, which is hosted at King's College London, but has been developed in partnership with the Trivedi Centre for Political Data at Ashoka University. And this is an effort to map the subnational, the state level policy response and impact of COVID-19 on social and economic outcomes. So I will introduce you to the website, which is still a work in progress, and give you a little bit of a flavour for some of the data that you'll find there, but encourage you to look at it more yourselves if you're interested. And I'll end with some thoughts about how we might contextualise the response to COVID-19 within longer term developments in the politics of federalism, and I'd be very glad to have some discussion about how the pandemic shapes the future trajectory of Indian federalism, and what the kind of flashpoints and tensions and questions that are emerging at the moment are, and how we should think about those. So if we think about the broad kind of baseline of India's policy response to COVID through a federal lens, I think it's hard to ignore the fact that by invoking the Disaster Management Act in March, India's central government has led a very centralized and strongly coordinated from the centre policy response to COVID-19 when it comes to the adoption of very stringent social distancing measures. So I'm going to show you just a snapshot of some comparative data on the stringency of the central lockdown in a minute, but I think it's fairly widely recognised that India did adopt and continues to have some of the most stringent social distancing measures in place for the number of cases. Of course, the number of cases in India is high, but the strength of the policy response is also high, strong in comparative perspective. And even with the easing of the first national lockdown, the management of the containment zones, which have then followed from the nationwide lockdown, has also been centrally coordinated. And of course, now there is a new layer of central coordination of any further lockdown measures that states might want to adopt this month, as we see a kind of spike in cases. So this, in a way, creates something of a puzzle if we think of the scenario in other big countries with federal systems of government that have also had heavy, large COVID-19 caseloads. And I think the contrast with Brazil and Brazil and the United States is quite striking. So in both Brazil and the United States, you've had relatively weak central or federal level enforcement of social distancing, and you've seen governors in both countries stepping into the breach and often taking more stringent action at the state level to compensate for inaction at the federal level. So I think India really has inverted that scenario, and I think that's quite interesting to note, especially because in some other ways there are parallels in the style of political leadership with a strong, more populist inclined national leader in Narendra Modi. So that is an interesting contrast to me. I'll just show you this comparative data. Some of you might have seen this before. This comes from the Oxford University Government Response Stringency Tracker. I've just rather at random here, taken a snapshot of the data in July. So after the relaxation of the first nationwide lockdown, and you can see that India is right at the front of the pack in terms of the stringency of the central government response to COVID compared to other countries. And I've given you the web address there if you want to look at this in more detail, but the stringency tracker tracks things like school closures, other social distancing measures, travel bans, and so on. So in comparative terms, this is a kind of a strongly coordinated central response that is more stringent than other comparable countries. So that is of note. Probably not surprising to all of you. It's in some ways it's not surprising to me either. There are obviously questions about whether the central government was right to invoke the Disaster Management Act, which of course was not really designed with the pandemic in mind. It was designed more with natural disasters in mind. But in other ways, the pretty centralized response to COVID-19 is in line with the design of India's federal model. So India's model of federalism is more centralized by design, especially than the two federal systems I've just compared India to in terms of the pandemic response, Brazil and the United States. And that's documented in a kind of a lot of work on the constitutional elements of Indian federalism. The Constitution deliberately left scope for strong central intervention, even in areas that are designated as state subjects, and that's the case for health, of course. That's both through the ability of the central government to enact emergency powers, but also lots of other constitutional elements that permit the central government to act in the domain of states. And those provisions were adopted at the time of constitution making, with an eye to some of the coordination problems that were emerging in the mid-20th century in other federal systems where there were weaker mechanisms for central coordination. And a pandemic is a kind of classic example of a phenomena that creates that has spillover effects, that creates externalities across political boundaries. So inactions or actions in one state in terms of how they respond to the pandemic have impacts in other states. And that, of course, generates a kind of theoretical argument in favour of central coordination in some policy domains. And it was in response to those kinds of the potential for those kinds of policy dilemmas to emerge in India that certain elements of India's federal constitution were designed in the way that they were. So, a long kind of argument, but in some ways we shouldn't be too surprised about the kind of centralized nature of this response to the pandemic. That is stepping aside, kind of bypassing the question of its effectiveness, but in constitutional terms, it is in keeping. But of course, we have to understand this centralized response to the pandemic in light of a much wider set of moves towards centralization in recent years, and particularly since the election of the Modi-led BJP in 2014. And I'll come back to this at the end of my talk, but we can see across the political, fiscal, and administrative dimensions many ways in which there have been moves towards much greater centralization. So it's not only constitutional permissiveness, this is also part of a bigger drift towards centralization. And that drift towards centralization coexists with the fact that the states remain crucial in terms of thinking about the outcomes of the pandemic. And that includes managing the social and economic ramifications of the centrally imposed lockdowns. And I'll talk now a little bit more about why I think states matter and some of the variation that we've seen across states during the pandemic. So, we all know that the national lockdown was introduced very rapidly, more rapidly than in many other countries, and that it was announced before the social safety net interventions were put in place. So we will all, have in our mind the image of caravans of migrant workers moving on foot once that national lockdown was imposed and their sources of livelihoods were curtailed overnight. So in the absence of effective social safety nets or an effective policy preemption of what the consequences of the very rapid national lockdown would be, state governments and local municipal governments were placed at the forefront of responding to the human fallout of that lockdown imposition. So that's one. The local levels of the state were called in to play in order to respond in that emergency. The second thing I think to keep in mind is that even before the pandemic, and even in an era of greater centralisation, there is a lot of diversity in the ways that state governments approach the implementation of national policies, and in the ways that they supplement them in some instances, or prioritise which are more important or more in tune with the needs or preferences of populations at the state level. So there is, the reality is that even policies that are centrally designed travel through state level filters, which shape the way that they're implemented. And of course, when we're thinking about a pandemic, we are in a terrain which is traditionally and constitutionally the terrain of the states. So health is a state subject. We know that the public health response to COVID and the communication of the public health response to COVID varied a lot across states. And we also know that there's a lot of variation in the public and private health infrastructure across regions and in the capacity of the local state. So in short, states mattered before COVID and they matter after the arrival of the pandemic, despite the centralised nature of the policy response. And that brings me on to Decov India. Decov India, I haven't written it on this slide actually, but it stands for the D comes from decentralization, the COV from COVID-19. So Decov India, which is a project that was led by the King's India Institute at King's College London in partnership with the Trivedi Centre for Political Data at Ashoka University and a team of research assistants who were based across India and at King's. So there were about 15 people working on this project through April till the end of the summer. And we set out to try to build a database which we would continue to update regularly, which would provide a real-time perspective on the evolution of the policy response to COVID across states, and also the impact of COVID on social security and the economic life across different regions. And we've gathered data on 4 main headings. We've got kind of basic mapping data on the kind of health infrastructure capacity across states. And we have done quite a bit of work with the thousands of government notifications that were issued by state governments and central governments. So, as many of you will know, this was a kind of policy response through through the kind of proliferation of government ordinances, and there have been some terrific efforts by different organisations, particularly PRS Legislative Research, whose portal we've used a lot, but also other organisations like Devara Research and others who have built policy response trackers. So you can go to those portals and download a very extensive list of all of the measures that Andhra Pradesh or Telangana or Maharashtra have announced in different domains. Where we came in was to think, well, there's a lot of paper here and a lot of kind of, a lot of signs that there's a lot of, announcements being made across states. It's rather difficult to actually compare what's going on across states if we, just by looking through the kind of volume or announcements made. So where we tried to make a difference in Decov India was to look at, to seek ways of comparing the content of those notifications across states. So for instance, our researchers were able to dig down into the kinds of pledges that were made by states to introduce additional food subsidies. If you looked at those on paper, it looked as if most state governments were being extraordinarily generous, giving months and months of free food rations, or reducing the price, or targeting them at different beneficiary groups. But it was very difficult to actually see what was going on and how you compared the size of the beneficiary groups across states. So some of the work that our team did was simply to try and make those pledges comparable. And when it came down to it, actually, there was actually a much smaller range of additional benefits that states were offering on things like food subsidies, and only a handful of states that really stood out for doing things that looked much more generous than than the national baseline. And we did similar things to look at the cash transfers given to construction workers, or the health insurance offered to frontline workers. So the ways in which states were appearing to supplement the the baseline package that the central government announced through the Prime Minister's Garib Kalyan Yojana. So we did a lot of work on the social security front in that. We also, in a separate stream, led by my economist colleagues at King's, Amrita Dhillon and Sunil Batra Kumar, looked at things like Mundi prices, electricity usage, and so on, to track both the extent to which the food supply chain was holding up during the pandemic. So looking at the way that markets were functioning, looking at the prices, looking at volume and price indicators, and also to look at how the lockdown was impacting on business and industrial activity. So we looked at pollution data and electricity data. We've got data on the registration of new firms, the supply of credit, and so on. So you'll be able to go to the website yourselves and look at that data if you're interested in diving deeper into one of those domains. And we're just working on the next data update, which should go live across the next month. I'll just take you a bit deeper into the social security data. That's the bit that I've worked on more. But Akshat, do tell me if I'm talking for too long. How am I doing for time?
No, you're doing great. We have time. Please go ahead. Yeah. Okay,
thanks. So just to give you a bit of a feel for some of the variation that we found on the social security side, and a bit of an introduction to what is hosted on the Decov India website. Of course, when we're thinking about social security, a few weeks after the national lockdown was introduced, the central government introduced the Prime Minister's Kalyan Yojana, which was a kind of national policy umbrella, which basically worked within the existing social security architecture, but offered some increases to existing entitlements. So there was an additional food grain entitlement that was made free. There was a pretty modest wage increase under the Mahatma Gandhi National Rural Employment Guarantee Act. There were additional cash transfers that were made directly to women who had Jan Dhan bank accounts, and an accident insurance scheme for frontline health workers who die as a result of COVID-19 duties. There's pretty minimal accident cover really for COVID-19 frontline workers. And there were obviously some other measures which were related to formal sector social security, but that's a much smaller proportion of the workforce, so I won't touch on that here. What we were interested in seeing within Decov India, and in light of the fact that we know that there's a lot of state level variation in terms of how states in normal times implement these big central schemes, we were interested to see how these schemes were actually being implemented. So trying to go beyond the announcements on paper to try and track what was actually happening on the ground, but also to see whether states were actually exhibiting different policy preferences, and whether there were different kind of packages of policies that were emerging at the state level, which might turn out to be significant in the ways that states emerge from COVID. That's the piece of work that we haven't really started even to do yet, because we're still in the middle of the pandemic. But in the longer term, I hope that this exercise will help us to be able to actually map what the policy response looked like at the state level, and whether that actually led to differences in the kind of longer term impact of COVID. looking at the social security data, it is kind of clear that within that national umbrella, different states have taken somewhat different approaches. Actually, perhaps somewhat less variation than I expected to see at the beginning when I mentioned the question of food subsidies, for instance. But there were some important areas of variation, and those reflected, unsurprisingly, I think, the different public health scenario across different states, the different demographic composition of the population across different states, and of course local political economy factors and the kind of longer term legacy of approaches to different policies. So some of the things that struck me, for instance, looking at the data in the months immediately after the March lockdown, were that, of course, straight after the lockdown, most states saw a big decline year on year in the number of NREGA workdays. But from late April, May, as the lockdown started to increase, the number of NREGA workdays also started to increase. But that was not a uniform picture across the country, and the pandemic itself seemed to have reduced the utility of NREGA for some states, including states that were kind of traditionally strong performers in using the scheme, like Kerala and Tamil Nadu. Where state governments took the deliberate decision to reduce reliance on NREGA and instead supplement the incomes of informal sector workers through direct cash transfers. And in some other states where traditionally NREGA use has been lower, like Maharashtra, in more recent years, the number of work days increased, but the payment rate fell. And I'll just show you a couple of screen captures from the website. And as I say, please do go to the website directly because it's much more interactive than I can be in a presentation here. But this slide gives you a picture over time of the month by month, year on year comparison of work days under the National Rural Employment Guarantee Scheme. And this is a snapshot from late May. So that's the point at which the national lockdown has eased, and we would expect to see an uptick in work days across most states. And of course, that is the case. You can see that the warmer colours, the more orangey red colours, you're seeing a quite major increase year on year in the number of work days worked across most states, but with that exception of Kerala and Tamil Nadu, states which have larger elderly populations that in a normal year would be more reliant on NREGA, but in this year were being discouraged from NREGA work and being supported in other ways to some extent. So that I think is interesting, that we see some states adapting their social policy package in response to the pandemic to the extent they have space to do that. This is another set of charts on the website which look at the average wage paid under NREGA compared to what is supposed to have been the notified wage under the Prime Minister's Garib Kalyan Yojana, which was of 220 rupees a day. So that's that top line, the notified wage this year. You can see that Maharashtra, this is just one state, Maharashtra has not reached that notified. It's just about, looks like it's heading that way by September, but actually saw a big dip in May, just at the time when demand for NREGA was increasing. And that is consistent with the political economy of Maharashtra, where NREGA wage rates have traditionally been kept low in order for it to really be a kind of social safety net that agricultural labourers can fall back on in hard times, but not to deter them from agricultural labour. Of course, we know that during the pandemic, it wasn't only the agricultural workforce that was relying on NREGA. So this suggests that in one of the hardest hit states by COVID, where there was an increase in demand for NREGA work, that was at a much lower rate. So consistent with kind of longer term local political economy, but suggestive again, I think, of the importance of state governments in designing local responses to COVID within a kind of national policy umbrella. This map, just the last of the three I'll show you from the project website, shows you the extent to which states had distributed their full additional food grain entitlement under the Prime Minister's Garib Kalyan Yojana. So this is from the final. This was the first 3-month tranche. It was then extended, but this is just the first 3-month tranche. And it shows you that most states did pretty well in distribution of their full additional entitlement, but with some variation across the country. So again, in Tamil Nadu, in West Bengal, in Uttarakhand, where states hadn't quite distributed the full entitlement. We don't know, I mean, it's very difficult working with public data reported by states through a central portal here to know exactly what's driving that variation on the ground, of course. So it could be that states were delivering additional food subsidies under their own state level schemes that they weren't reporting through the central portal. So there are probably reporting issues here that we aren't able to get to by virtue of the fact we're having to rely on public data. But I think it is suggestive of the fact that states that there are kind of important variation in the state level response. So where does that take us in terms of thinking about the bigger picture? And as I've said, the Decov project is much like the pandemic itself, an evolving project. We haven't reached an endpoint yet. So my intention here is really just to introduce you to the data and some of the questions that it's starting to raise, and to welcome your engagement with the project website as we go ahead. In thinking about this in terms of the bigger picture, as I've said, the longer term impact of this subnational variation in how states have responded to COVID-19 and to the lockdowns remains to be seen. But I think, and this would be one of the takeaways from what I've been talking about today, that the kind of variation we see across states, especially the variation that is driven by the local public health scenario, suggests that it is important that state governments have space to tailor implementation of national policies according to local context. And of course, this goes back to the kind of, old theories of decentralization and the scale at which policy responsibility is best exercised. So I think there is a kind of strong case for thinking about how important it is to preserve the space for some state level autonomy over the kind of localized design of policy. And that is all the more important in the current context, because in all sorts of ways, the space for states to frame and develop their own distinctive policy agendas is under pressure. It's under pressure in fiscal terms. We've seen recently, of course, the disputes between the central government and the states in the GST Council around who bears the kind of responsibility for GST compensation to the states. And we will have soon the 15th Finance Commission report, which is likely to herald a kind of shift away from the move towards greater fiscal decentralization that we saw in the last Finance Commission report. And we know from the recent RBI study of state budgets that there are lots of reasons to be concerned about the fiscal status of the states. On the political front, we've seen a very marked shrinkage of the kind of political space for states to claim credit for their role in implementing government policies. And I'll show you a bit of data on that in a minute. But this has been a very marked shift since 2014. Under the UPA government, and I've written on this in previous years, but under the UPA government, there had been a kind of decentralization of credit claiming, and state governments were able really to own in many ways the electoral credit for taking a lead on improving the implementation of central schemes, especially things like PDS or NREGA, which almost in voters' eyes became seen as state government programs. That logic has really been turned on its head since 2014, when there has been a very determined push by the BJP to claim credit in the person of Narendra Modi often for all government schemes. So a very personalised and centralised way of claiming electoral credit. And the third leg of that squeeze on the space for states is a process of administrative centralisation and the recourse to new mechanisms that often allow the central government to bypass state governments altogether in the implementation of central programs. So whether that's the distribution mechanism for the Ujjwala scheme or the increasing use of direct cash transfers, so things like the Jantan payments into women's bank accounts. So the use of technology in ways that allow the central government to make direct transfers to citizens rather than moving through the states. So I think on those three crucial planks, political, fiscal, administrative, the state space is being squeezed. And that's why we see at the moment a lot of tension in the relationship between the central government and state governments, and especially, of course, opposition ruled state governments, because the centre-state relationship is being drawn into a partisan divide as well in the current moment. So just before I wrap up, I said I'd show you a little bit of data on credit, the centralisation of credit claiming. This comes out of some work that I've been doing for a long time with colleagues in the Logniti network, especially with Rajeshwari Deshpande and KK Kailash. And this table comes from a paper that we published last year, which looked at the importance of welfare schemes in contributing to the BJP's 2019 Lok Sabha NES surveys over time, and are continuing to do so in rounds of state elections and so on, is this question of who voters credit for the implementation of welfare schemes. And what you can see in this table is, of course, some of these schemes are new, so they weren't questions that were asked in previous surveys. But for most schemes, there is quite a pronounced tendency of voters to credit the central government rather than state governments, which looks markedly different in the 2019 data compared to the 2014 data. The main exceptions there are pensions and the PDS, where voters still tend to attribute those to state governments. I'm going to be very interested to see whether that remains the case for PDS, given the moves towards one nation, one ration card, and the attempts by the central government to claim much stronger credit for food subsidies as well. But in quite important ways, and I think the NREGA figures are very, are particularly marked here. You can see that there's been a complete inversion between 2014 and 2019 in the likelihood of voters attributing credit to the central government rather than the state government for NREGA. So, I think these really underline the kind of the political space, which partly explains the growing tensions that we're seeing between the central government and states. So to conclude, I started off by talking about the centralized policy response to COVID before I took us down to the subnational level. And I suggested that that is interesting in part because it is rather different to other federal countries, like Brazil and the US, but that it is actually quite consistent with the constitutional logic of India's federal design, and of course with the moves towards greater centralization that we've seen since 2014. Despite all of that centralization, state governments remain at the front line of the health and social policy response to COVID-19. And I think the variation that we've started to track through our project, but also there are lots of other people working on these questions, shows that variation in local conditions does shape policy choices at the state government level. And that raises the question about what the policy space open to states is to do that. And lastly, as I've just kind of ended with, the pandemic has, the context of COVID-19 has greatly strengthened tensions within Indian federalism. It has been the space for generating new centre-state conflicts, not all of which, of course, are directly related to the pandemic. And I think it has exposed the extent to which the space for states is constrained. And that's me.
Thank you, Dr. Tillin. This is an extremely useful presentation. And I think firstly, congratulations on going through so many notifications to you and your team, because we also went through them. And they're just thousands of notifications state governments have issued, often contradictory. To make sense of them, to sort of decide which direction are they going, is a really difficult task. So that's a really, amazing task that you and your team have accomplished in terms of making sense of the notifications across different states. I'll start with some of my own questions, and then we'll take other questions from the audience as well as and when they come. So I think one question I had about the project itself is, as you look at the Decov project, looks at economy, social security, and healthcare. Why this particular approach, and why these three themes? Could you just talk us through your thought, your team's thinking behind choosing these three themes and choosing this lens to understand state responses?
Sure. So this was a project grant that we received about 2 or 3 weeks after the national lockdown was imposed in India, and the motivation for doing it was partly the sense that already we could see that there appeared to be quite a lot of variation in how states were responding and the demands that were being placed on states. So whether that was the movement of migrant workers across states, states of origin, states, host states, states of travel, corridors of travel, whether that was the kind of the mounting sense that, oh my goodness, this proliferation of notifications across state governments, and how do we even start to make sense of this, and how does it relate to what we know about how the kind of policy frameworks that different states have worked within before the pandemic, and also how do we keep track over time of what is a very rapidly evolving policy context? So how do we know, or how in the future will we be able to analyze what the impact of these policy decisions have been on outcomes? And I think at that stage, none of us really had any clear sense of what the arc of we still don't know what the arc of the pandemic is going to look like, right? But we felt that there was value to trying to track some of these developments in real time in ways that would be harder to do retrospectively. So some of these data sets we will be able to reconstruct just because they exist in public data portals, and as long as those data portals don't disappear, we can reconstruct whether it's NREGA work days or levels of electricity usage, but other things might actually be rather harder to kind of track. The policy decisions that states were making, and how those changed over time. We still don't know the extent to which actually week by week decision making will have impacted the course of COVID, or the longer term prognosis in terms of the impact on rates of poverty, or economic kind of dynamism. But it seemed to us important that we try to track that in real time. And the reason for choosing the three sectors, well, health kind of prima facie was important because this is a pandemic, for me, I've spent a lot of time in the last kind of almost 10 years now, looking at kind of the dynamics of social policy at the state level. So I really wanted to keep track of the social security response, because I wanted to maintain that comparison over time, but also because it was absolutely evident that the imposition of such a stark national lockdown had laid bare really the very rudimentary architecture of social security across India. And so it really seemed like one of the most important dimensions to track in terms of not just the response to the pandemic, but the response to the consequences of the measures that countries have had to take, including India, to live with the pandemic through the enforced social distancing. So that was the kind of social security, and then on the economic side, the question of what kind of economic recovery India will have and at what stage is also of fundamental importance. And so we had one part of the team focus on the rural economy, because we were particularly concerned with this question about the kind of the food supply chain. And there have been others. I know there's a very good team at Ashoka who've been looking at the food supply question as well at the state level. And then it was a question of really thinking, what are the kind of other interesting indicators that we could look at in real time that give us a picture of what's actually happening in terms of industrial activity or business activity at the state level, which, because face-to-face research was impossible. At King's and most universities, there's still a ban on conducting any face-to-face research, and we can't travel. But even within India, you're facing those same constraints. So actually trying to map what is happening on the ground is very difficult. So that's why we spent a lot of time really thinking about what indicators could we use to try and track this in the absence of being able to do kind of boots on the ground kind of research. And of course we didn't do any survey research, but others did. So I think what we've done is really complementary to the kind of the efforts of survey teams, and it's a bit different because it's trying to take a kind of fully comprehensive view across states.
Yeah, no, that makes a lot of sense, and it's very useful. And I think this goes on to my next question, which was about in the pandemic response in India, at least we've seen a lot of debate about universal responses or standard responses, and the need to customize local conditions, and especially with regard to COVID itself, right? A lot of experts have pointed out how health data varies across states, because often states have different metrics to do things like certify deaths. That often leads to different ways of understanding how the pandemic is progressing across states. Similarly, we analyzed some of the correspondence that happened before the lockdown was imposed, and the center kept saying that the states are not implementing restrictions properly. There's a lot of, at least that was the official justification in correspondence. There is no uniformity in implementation, and that's the reason why we have to impose a national lockdown. So even in the discourse, or even in media, or even what the central government has been saying, there's this constant talk about, what is universal and standardized, as opposed to the state saying, oh, we must sort of tailor it to local conditions. And I think in your presentation also you said that a pandemic theoretically means sort of a centralized response. So that could be a theoretical argument, but other federations have worked differently or have tackled those problems differently. And I think another very interesting example, which you also spoke about and which we noticed, was this whole consent for lockdowns in other states. And we weren't sure what even the legal basis for that is, because this entire legal basis can be questioned, and one could say whether the Disaster Management Act gives you those powers. But for the center to say that any lockdown you impose anyway has to be with my consent is a bit much to anybody, right? Even from a purely legal and constitutional perspective. So what are some of your thoughts on this whole tension between universal and local responses in a pandemic, and what has played out in India over the past months, and the justifications the Union government has given for doing what it has done?
Yes, and it's a really interesting question, and I've only just really started to try and track how state governments are responding to this provision that they now have to seek consent for the state from the centre for any additional lockdown. And I noticed in doing that some interesting comments by Uddhav Thackeray in Maharashtra, who was calling for the centre to take a more uniform approach across states. So to impose a stronger, more uniform national lockdown for schools. This is going to be a really interesting terrain to watch, the extent to which states feel that they're constrained in important ways from taking measures that respond to kind of localized changes in COVID incidents. I suppose the extent to which the central government is sufficiently responsive to those localized changes. But also, I think what I'd be interested to watch out for are the way that the kind of politics. So I've talked a lot about the politics of credit claiming, right? So claiming responsibility for things when they've gone well, or they can be made to appear as if they've gone well. But what was going to be interesting is how and whether we start to see a kind of politics of blame emerging, and how centre and state seek to shift the blame to each other for the way that the pandemic is being handled. And it seems to me that there's some potential within this kind of tension around who decides about where lockdowns happen for a question of blame to creep in. I don't know whether that, you might have noticed more whether that's happening at the moment, but if chief ministers start to feel that they're under pressure to take stronger kind of measures to close schools or impose local kind of social distancing measures, but are being prevented from or held up in doing so by the central government, does that lead into a kind of new political dynamic? And similarly, if you start to see the central government wanting to ease lockdown restrictions out of a concern about the economic impact, could the central government start to blame states for for kind of the adverse economic consequences, or the kind of the slow economic recovery? So I think we could be entering, and of course we're seeing this tension around the kind of ongoing imposition of lockdowns emerging in countries around the world. So India is not unique in seeing those, but there are kind of, viewed from a federal lens, there are interesting questions around what it might do to the political dynamics of federalism, I think.
Yeah, no, definitely. I think federalism makes it an interesting subject because it not only brings in legal and constitutional issues, but also a lot of practice issues. And I think in your writing, you constantly highlight the role of politics and practice that is played. And I think this idea of credit claiming, and I had a question about it later, but I'll ask it now because it's very interesting. I think you and both Yamini and I have written about this. And as in you right now spoke about the politics of blame, but I was just thinking that if the central government is taking more credit now, or is claiming more credit for policies going forward, because inequalities will be worsened, and there may be a need for more interventions, even in terms of social security schemes or central schemes. Will the need, since the central government is claiming credit, will it further feel the need to intervene more and come out with more policies or schemes? And because once you start saying that this is what you are doing, then you also held accountable for not doing that later. And we may see a situation where the central government starts doing more of this going forth, with COVID changing a lot of other sort of social dimensions. And then, what do you see that happening? And how do we understand credit claiming then? Because we also know that the central schemes, or there's a lot of literature that suggests how it sort of interferes with legislative competence, right? Because these are largely subjects that states interfere with. The states have control over, but with central policies, they start taking control over those schemes, even in terms of policy design, etc. So how do you see that happening? Could this be flipped? Because once the center has claimed credit, it will also have to do more going forward.
Yes, it's a really important question. So I think the central government is keen to do more. And I think that you see that in the framing of the terms of reference for the 15th Finance Commission. So the central government would like more fiscal space to finance social programs, and I think the central government is interested. So we see this. You're obviously seeing this playing out with the farm bills, which are rather different at the moment. But there are a kind of analogous set of tensions when you start thinking about something like One Nation, One Ration Card. Or even the increasing reliance on Jan Dhan and direct cash transfers, that those are things that the central government can seek to do that bypass the implementing role of the state governments. And so I think you're likely to see more interventions of that kind. I think the thing that we have to keep in mind that the more we move in that direction, the more we lose some of the very important work that had been taking place in the within our lifetimes to empower panchayats and local tiers of government to play a very important role in the actual design and implementation of social interventions on the ground, in ways that respond absolutely to local needs and priorities. So of course, NREGA was the big example of that, if you're thinking about social security and the implementing role of panchayats, and the diversion of resources directly to the panchayat level in order to manage NREGA. So in a sense, that also bypassed state governments in transferring a lot of resource down to the panchayat level. So the more we move towards schemes that the central government can finance and implement itself, the more not only do we bypass state governments, but there's also a risk of moving away from those other localized forms of kind of designing social security interventions at the point at which they are needed. I think that I might not have did I respond to everything there in your question?
No,
I feel
you did
something else that I meant to say, but I can't now recall.
No, I think it answers the heart of the question. I think we can go on as we sort of. And the next question is also connected, and I think so. We have done some work in the past on how we should rethink the legislative allocation of entries in the 7th schedule, because it's something that is embedded in the Constitution, but we've seen over time in the practice of federalism, often we haven't followed that so strictly, right? And you've also written about how design features of the Constitution affect practice, especially on your work on asymmetric federalism. So what are your thoughts on how design features in legislative distribution, etc., affect policies on the ground? Because as in we constantly seeing greater and greater encroachment, but then also often the center just says, okay, it's health the state subject, so not my responsibility when it wants to do that. So is there a time, should we start rethinking about the redistribution of legislative powers? Because obviously currently it's there, and obviously Supreme Court has interpreted them really liberally over time and have given them the widest construction. But do you think that closing the loop would amount to rethinking some of these design features in the Constitution, so that there is proper legal and constitutional basis for what we are seeing happening in the practice of federalism today? Yeah,
it's a really interesting question, and it's one that actually I've spent quite a lot of time. I'm working on a long book project at the moment about the kind of history of India's welfare regime, which goes right back to the late colonial period, which was the point at which the Government of India Acts were being designed, and then of course the Constitution itself. And there were big debates then, which I think is still relevant now, about the role of grants in aid, so central government grants that kind of push or incentivize state governments to act even in domains that are the kind of legislative domain of the states. And at the time, that was a big debate in other federal countries across the world, especially in federal systems that were much more decentralized than India's is. And so there was greater need for that kind of mechanism to enable federal intervention in some of those kind of social security questions. But effectively, India has ended up both with a pretty centralized, federal constitution, where the state list is, there are important areas on the state list, but and health really stands out, of course. But kind of India has layered on top of its already centralized constitutional architecture of distribution of legislative competences a pretty extensive set of centrally sponsored schemes, which are forms of grants and aid, basically, which enable the central government to provide financial incentives for state governments to adopt or to follow the central government in implementing particular policies. And it's not, be interesting to hear your thoughts on the kind of legal and constitutional status of those centrally sponsored schemes, because they are schemes from which states can opt out, but they do so at the risk of losing fiscal transfers from the centre.
Yeah, the incentives are against it. They would not technically opt out because they need that money in the
Yeah. So they're pretty strong incentives. So I mean, it would be interesting to think about whether what India needs is a kind of first principles debate about the redistribution of legislative competence. But thinking about what the kind of outcomes of that might be, I'd probably expect a kind of expanded concurrent list, which would really just recognize the de facto practices around of centrally sponsored schemes and so on as a kind of means of incentivizing or enabling centre state. I mean, I hesitate before using the word cooperation at the moment, but policy alignment between the two. But are there particular domains that interest you where you think that there's kind of a need to redistribute legislative competences?
No, I think with regard to health, is the largest conversation we've been having in the recent months has been with regard to health, with the centre doing so much with regard to either the PMJY or with COVID, etc. Right? So is there a need to rethink redistribution of sort of health as a concurrent entry where some things do go to the center, some aspects of health regulation, etc., while other aspects are taken over by the state? So, I mean, that's a very complex debate, and it will vary from entry to entry, because you really have to look at each entry as a scope, as a entry of governance, and then take a call on where you think the current distribution lies in the sort of whether the state or the union. It's again very hard to also justify why it should lie with the union or why it should lie with the state, because there are no clear principles on it. And I think in your book, the Oxford Short Introduction to Indian Federalism, you cite these letters from Nehru where he's very angry and he's like, no, we can't implement anything because we don't have the machinery to implement something and we are the central power. And you said that right now, that most central federations have the mechanisms to implement policies. But in the Indian Constitution, they didn't. And it's a very visibly exasperated Nehru who's like, we can't implement anything and states can just blame us for lack of money, and we can just say that, we did this, but the states are not doing it. And I think you point out in your book that often states have, their incentives differ. So there are also local political concerns and things like that, which often change their perspective on what to implement and what they can do. And I think I was reading somewhere on even the farm bills. Many states can never take this step, even if they would believe this is a good policy, because of local interests. So often states may find it convenient to give the ball in the center's court rather than fighting that battle that you've taken over my legislative domain. It's easier to say that you did it and I'm just implementing it. So that's a very nuanced debate, I think, in terms of what states do and don't do. As in, my question related to this and with the pandemic also was this again on your writing, because you have written a lot about how since the dissolution of the Planning Commission, we haven't had enough mechanisms for center-state coordination. And again, the Interstate Council has been defunct. And again, it's fairly established in literature. And I think during COVID, we saw these massive meetings between the Prime Minister and the Chief Minister. There's some kind of communication mechanism, similarly with the Cabinet Secretary and Chief Secretaries in various states. So in some ways, how do you see this center-state communication happening? And how do you see, do you foresee any, and again, there's obviously literature on party system, right? And you have written about how we've come back to a single party dominance in this parliament, but regional parties at states, so the single party not being that dominant enough. And what used to be an intra-party thing has now become, there's no sort of informal mechanism of conversation anymore. So, and perhaps some people could also argue that the COVID response has been a failure of communication at one level, and the center and state being unable to sort of coordinate or communicate with each other. So where is cooperative federalism then? So what are your thoughts on that? Can we think of new mechanisms, or since clearly informal structures may not work, and we have these large dalbars of sort where the PM is talking to the chief ministers, but it's not a formal thing. So how do you think about that?
Yeah, and I think the trouble with those big dalbars is that these are not institutionalized spaces for policy making. So they are, spaces for, at best, they're spaces for dialogue. But then without having actually a kind of a space in kind of negotiations either over the design of policy or the decisions about what should be fiscal priorities for individual states, which is a function the Planning Commission used to serve. Yeah. They're not really much more than talking shops, and you could see that in that there was, I think, one of these conferences between the Prime Minister and Chief Ministers before the national lockdown, but it didn't take an agreement on the imposition of a national lockdown, which was then enforced by the national government, much to the kind of consternation of many state governments. So that exposed, I think, the kind of absence of a real mechanism for policy kind of negotiation. I think the space which has been so disappointing during COVID, which was really thought of as actually introducing a new institutional space, is the GST Council. That kind of in constitutional terms was one of the most important potentially kind of innovations in terms of creating a body which had clear, voting rules and a kind of clear, set of a clear agreement around shared responsibilities for decision making in an area that was a shared responsibility between the central government and the state governments. But I'm afraid that the fallout of the fight over the central government's refusal really to live up to its commitments to compensate the states over the GST shortfall has really exposed, I think, the kind of fragility of any it's exposed the fragility of any independent institutional space right now, but it's certainly exposed the GST Council as as not so far, I think, having played the role that it might have done in creating a kind of forum for dialogue between the centre and the states. And as you say, of course, the change in the political landscape that means that some of the informal political party-based mechanisms for that dialogue have also fallen away because we've moved away from national coalition government, which, in the absence of having something like the interstate council functioning, at least actually served in practice as a space for some kind of negotiation between the interests of the states and the centre. And you can critique that for all you want, the kind of the self-interest of state governments and the ways in which they approach bargaining in that space. But there was at least a space for bargaining, it's not clear to me really where that space is right now, and I think that's why we're seeing tensions spilling over in much more overt ways onto the streets, with the protests against the Farm Bill, state governments taking their own legislative action to try to contest central legislation. So what role the Supreme Court will then have to play in adjudicating the kind of the jurisdiction of the centre of the states in these matters will be one to watch. But I think it is inevitable in a period of a single party majority government at the centre that without these institutions of centre state dialogue and cooperation and negotiation, that you will see those tensions spill out into other forms of political conflict.
And I think I'll just have two more questions and we'll quickly move to audience questions after this, and I'll ask them together. One is, as you said, the role of the Supreme Court, and that's one to watch. And I think in the recent years, the Supreme Court has also received a lot of criticism for being extremely passive and has been called more executive-minded and a lot by Indian commentators. So if you were to hazard a guess what role the Supreme Court is going to play in some of these interstate tension, what is your expectations from the Supreme Court going forward? Because in a written constitution, it's supposed to be an empire between center-state relations. So where do you see the Supreme Court going? And the other is a larger question about whether you see some of these trends as being cyclical. And again, in the literature on federalism, it talks about, in India at least, first 20 years, there was a single party dominance in center and states. Similarly, then we saw challenges to the central single party emerging eventually. Then we had full coalitions. Now maybe we are again moving into a single party era. So maybe, I mean, these are not, as in one could say that they're not institutional or other issues, but are largely cyclical issues which are part of politics and have been happening, and there's nothing new that we are seeing today. So what are your thoughts on that? Do you think this is cyclical and we will sort of tide this as politics changes going forward? And or this is something completely new that we're witnessing right now?
So yes, I think these are cyclical issues, and they reflect the fact that the political landscape plays such a large role in shaping the kind of de facto dynamics of federalism, so the kind of the practice of federalism, and that goes back to the constitutional design, which enabled that. The fact that there isn't a kind of truly territorial chamber in second chamber in the Rajya Sabha is a kind of is a shadow really of the Lok Sabha, with some historical delay. The fact that India has a parliamentary form of federalism and not a presidential form of federalism means that the role of the composition of parliament plays a much more important role in the actual practice of federalism. These are kind of by design, in Indian federalism is much more susceptible really to political change, pushing change in the practice of federalism. So, while it may feel that certain issues are coming to a head now, and they're coming, there have been periods in Indian history where issues have come to a head in a rather similar way. I think of the early 1980s really as being the kind of point of comparison. I don't profess to be able to read the future. Where we cycle back to after this, but I think the thing that actually I haven't touched on yet, but of course is actually really crucial in distinguishing this era, is also that we have a government that that has a particular social agenda, which is more pronounced than in the kind of previous period of one-party dominance. The kind of the remaking of a social compact alongside a federal compact, I think, is more, it suggests that we are in waters that are new in that sense, and decisions like the abrogation of Article 370 and the kind of the resilience of a kind of multi-ethnic idea of Indian federalism, I think, are under a lot more pressure, and those I think those have moved from being what many people assumed had become kind of settled parts of a federal consensus in India to being things that are fully open to question right now. And that could mean that there are very long-term effects of the political dynamics at the present moment. And on that, I'll come back to your first question on the role of the Supreme Court, which I think is going to be really interesting. I can't say I hold out very high hopes at the moment, but actually what's also interesting to me on the Supreme Court, and I'd be really interested to hear your thoughts and your colleagues' thoughts on this, is that in some ways the Supreme Court has actually over the course of India's history not played a very pronounced role in adjudicating kind of questions that are important for federalism. And I realised this a lot when I was researching the piece that I wrote for the Oxford Handbook on the Indian Constitution about asymmetric federalism, where I looked over every single Supreme Court judgment on that related to any of the autonomy provisions in the Constitution. There were about 20 of them in total. So there are about 3 or 4 important judgments on Article 370, and there are also a tiny handful on Article 371, and then there are actually a slightly larger number on the ability of medical colleges to operate in Andhra Pradesh under the special provisions for Andhra Pradesh and Telangana and so on. But actually you can count on one hand probably the number of significant Supreme Court decisions on the kind of autonomy provisions of the Indian Constitution, which are often seen as being a really fundamental part of what is distinctive about India's federal constitution. And then when it comes to kind of determining the legislative balance between the centre and the states, it would be interesting to hear from your views on this, but the Supreme Court really doesn't actually seem to have been a very important actor. It doesn't really seem to have stepped into it or been called on to step into its umpire role over time. There are obviously kind of important exceptions. So, reading federalism into the basic structure, you're probably thinking, that was probably important back in the day. But more recently, I mean, now I'm starting to think there are exceptions to this argument. Maybe I should ditch it. But the bomb judgment. But they're few and far between.
Yeah,
rather,
I think platitudes. Yeah, sorry, go ahead, please. I think there were more platitudes. In fact, we did this study for legislative competence, where we realized that there were very few cases that actually ever held that this legislation fell into a certain entry, which would mean the Supreme Court was only called upon to decide whether the legislation violates the seventh schedule or the allocation of powers. I mean, I forget the number right now, but there were definitely less than like 30 or some judgments which we came across where they'd ever decided this. And you would think that this would be more. And I remember reading the white paper to the government of India at 935, where they came up with this distinction. They said this will introduce a completely new kind of litigation in the subcontinent once we come up with this distribution of powers, because people will constantly challenge whether this falls into the domain or not. But clearly they were not prescient about it because it didn't happen, and legislations haven't been challenged. And very interesting to study why that is so and why the Supreme Court hasn't played enough of a role with regard to this. So I guess I echo your belief that maybe then it's done into larger issues of federalism, as in a very basic structure way, or this is the spirit of federalism. But I don't think it has really gone with the nitty-gritties as much. And one will obviously do more research to come to that conclusion. But yeah, perhaps because even legislative competence, we don't come across that many cases where the Supreme Court has held this legislation falls into a certain entry or not. But it's also interpreted them really broadly in cases. And there are cases that have led to this idea that the union can do almost anything now, because it's either incidental encroachment or it's residuary. It's very easy to give the union more power as opposed to the states with legislation also. Now we should move on to the audience questions and start with that. So this first question is from Dhwani. So this is regarding your Decov project, and it's about what are some of the metrics that will be used to assess the success of state variations in your project?
I have to be very honest that we haven't really developed metrics for success as yet. I think thinking about what I would probably want to do in the longer term, it would be to start to try and categorize the extent to which there was important variation across states and the way they responded to COVID, and then to think about what the impact of that variation has been on, I mean, the kind of the things that are would be of concern would be, to what extent have states been able to step in to ameliorate the vulnerability of people falling back into poverty. There'd also be questions obviously around the nature of the economic recovery that one could ask using some of the data that we've got potentially, but it would be really thinking about how policy interventions might have shaped the kind of the role of the states in having an impact on some of these questions around the kind of social and economic consequences. One could also, of course, but I'm not sure we have enough data of this kind in our project that's distinctive to our project, but obviously there will be other questions to ask about actually the containment of the spread of COVID. And we decided that there were enough other people doing great work on tracking COVID cases and recovery rates and testing rates and so on that we didn't think it was worth us duplicating that effort. But I think there will clearly be a lot of analysis over time, and this will be cross-national as well, about which policy responses were more effective in reducing transmission and reducing serious illness and so on, which would go beyond my competence.
Sure. The next question is from Hartej. Is the move towards greater centralization post 2014 necessarily tied to the subsequent absolute majorities the ruling BJP enjoys? Are there some other structural factors that explain this galloping towards centralization? I think we've also spoken about this, but we could sort of quickly answer this again if you.
Yes, so I think actually it is important to note that there were some kind of, I suppose, signs of centralization that precede 2014. So some of the things that we might see as reflecting centralization post 2014. So the GST Council would be a good example of that. Are initiatives that preceded the election of the BJP. Are there structural kind of pushes towards centralization? I mean, I think that, you asked actually the question about kind of whether these are cyclical things. I think it's not only in India that there has been a kind of reckoning with decentralization, and whether, decentralization has reduced the ability of the central government to make interventions that, are deemed important, whether it's for questions of kind of welfare universalism and ensuring that there is, that the central government can play a role in reducing inequality, or whether it's questions around, leading a kind of a kind of reforms process where, which obviously the BJP is attempting to do more assertively at some level from the centre. With what success we will see, but so there were, I think, some pushes towards centralisation that preceded 2014, but I think it's taken a very pronounced shape, and especially with the kind of the discourse and the framing of one nation policy making since 2019. I think we've seen with the re-election in 2019 a real reassertion that this is the agenda of this BJP government.
The next question is from Kim. Considering the discordant and in some case outright conflict between the central government and many states in India today, what do you think of the view that greater centralization is necessary to facilitate a coherent pandemic response despite the diversity of problems?
Yeah, this is a question which I grapple with a lot, especially when you think about the kind of the challenges that federalism presents for welfare state development. So some scholars have argued that federalism and welfare states are necessarily in tension, because a welfare state is premised on the idea of universalism, and federalism is premised on the idea of diversity, and that these two necessarily have to come into conflict. And the way that I think about this usually is to think that federalism is a political compromise, and in India's case, it's a political compromise that is absolutely essential in order to recognise societal and ethnic diversity and linguistic diversity. But that recognition, and I mean, and this in a way was, I think, the spirit of the way that federalism was framed in the Indian constitution, in the minds of Ambedkar or of Nehru in the Constituent Assembly debates, that this was, federalism was a necessity to recognise and reflect India's diversity, but it had to be a kind of federalism that left room for a strong central government in order to respond to the kinds of developmental challenges that they saw India as facing, and in many ways that kind of conundrum remains, and the debate around, Akshat, you asked this question about whether India needs to reconsider the idea of whether health should remain a state subject, which has kind of bubbled away, I think, as a debate for some time. But it does really bring to light, I think, the importance of the fact, especially in a field like health, in some ways, the fact that health remained a state subject alone, actually, of all of the major social areas of social policy in the constitution, I think reflected the very low priority that was given to public health and at the time of constitution making. Without wanting to suggest that India should become more centralized, because I obviously find problematic some of the ways in which centralization is occurring at the moment, at a kind of theoretical level, and thinking about, the kind of the idea of how you strengthen a kind of universal health system in India, I do think there is also an argument that needs to be taken seriously about the role for central coordination. And maybe, as Akshat, you were starting to suggest, that would actually mean separating out functions within the health domain to look at what should be the kind of in the domain of the central government and what should remain at the level of the states. But it's a really fundamental dilemma.
And I think also in discourse, because you often see people demanding for central laws all the time. They often don't demand for, even lobbying for laws is often at the central level, because I think it's easier to say, I want an all India law. And you see that all the time in the healthcare sector in India. Like, I don't know if you followed the recent healthcare violence controversy, violence against healthcare workers in India. And they kept demanding a central law to deal with violence against healthcare workers. Well, technically, it could have been something that you could do at each state. And states already had laws. I mean, 18 states had their own laws dealing with a specific issue, yet they wanted a central law on it. So perhaps there is also some value in terms of, signaling the center doing something in a certain domain. I think Dhani has a comment on this, on the question you answered, and she talks about how it may be useful to study litigation around certain issues to understand their success metric. And in Vidhi also, we ourselves studied the regulations under the Epidemic Diseases Act that all the states issued. And it became very difficult for us to understand what the impact of these regulations were, which were there across different states, because this was just the regulation, and afterwards there were executive notifications. So I think she had a comment on whether court litigation could be a useful way of understanding some of the success metrics of the policies that you have. We can come to this, and then there are two questions which Mr. Vagish Harati has, and he says you can answer either. I'll just raise both to you. This is a bit of a crystal gazing. His first question is, how long do you think centralization and one-party dominance is going to last, according to your reading? And the other one is, what is the possibility of maintaining parliamentary federalism in India in the coming future?
Would that I had a crystal ball. I mean, I don't know. They're obviously, the BJP in the past has wanted to explore the idea of introducing a presidential system in India. I think it has other priorities at the moment, and also, of course, in some ways, it has adopted a slightly more presidential style of governing under Prime Minister Modi, even if that hasn't involved really a serious debate about presidentialism, and perhaps we ought to be debating that. So I don't see any immediate prospects of India moving away from a parliamentary federal system. In fact, I think it probably suits the BJP's political agenda quite well, because it means that once you have control of parliament, you have control of the executive. If you had a presidential system, then you introduce more political checks and balances potentially into the equation, which would lead to a very different scenario. And I daren't really answer the question of how long it will last.
Yeah, I think, and do you have any comment on the idea of studying litigation for understanding success metrics? Or?
Yeah, it's interesting. I'd be interested to hear more about how your work on that goes.
Sure,
I mean, is the kind of, Dhvani, are you thinking of instances where, I don't know, civil society organizations could take to the courts a challenge that a state government or the central government hasn't implemented an ordinance effectively?
So I think our reading of this was that often this was court-led, that often the court told the state government to do various things, after which the state government said, okay, now we must issue notifications on all these things, because often high courts end up taking up matters suo motu. And we've seen them across the pandemic, various high courts have these long-running matters that they've taken up a lot of pandemic governance, so to say. And they keep asking the state government to do certain things or not to do certain things. And often that leads to a lot of policy change, because it's all court-led often. And it's often, and how there's obviously a lot of literature about how PILs become long-running cases, and then they keep sort of interacting with the executive, and it's happened in India. It's happened in testing, for pricing for tests, and treatment, as well as a lot of other domains where courts have really played an active role in terms of influencing the kind of executive action that has also happened.
That's really interesting, and it's not something I followed at all. But the idea that it's courts that are leading to the kind of production of all of this paper is a very interesting example potentially of judicial activism, I suppose, in shaping the way that states responded. So I'd be extremely interested to follow if you end up writing more about this, because I think it sounds very important, but it's not something I've looked at yet.
Yeah, sure. Yeah, I think Vidhi just clarified that about effective implementation and challenges to center state competence in certain kinds of measures, which private hospitals. So yeah, I think we have almost reached the end of the session also, and I think I just had one more question on email which someone had sent about this is the last question for the session. Are there successful models of center-state or state-state coordination from other countries that India might be able to draw lessons from? And I know you might just say India's model of federalism is unique that way, so therefore it's hard to draw comparisons, but would you hazard to answer this?
Yes, I mean, this question of intergovernmental coordination is something that I think all federal systems grapple with in different ways. India's, I think, is less well institutionalized, partly because of, as I've said, the territorial design of the Rajya Sabha and the nature of parliamentary federalism. So that already takes out some of the institutional spaces for intergovernmental negotiation that would happen, within the Senate and in the Brazilian Senate or the American Senate or something, where there's where the Senate plays that kind of role as a territorial chamber, and in which states have a kind of equal say. There are lots of other examples in different countries of different forms of an intergovernmental council that have different kinds of statutory roles and are often formed to, around a particular kind of policy domain. I mean, the GST Council would have been a good example of one of those. But it's hard to say there's an off the peg solution that India can learn from. But there are lots of other examples of more institutionalized forms of intergovernmental cooperation, and India's had them in the past. Water sharing agreements are another example of that kind of intergovernmental cooperation. So I think it's a combination of learning from examples, but also, I suppose, developing the political space in order to actually institutionalize something and to maintain it. And it's not just a question of creating the institution, it's also a question about all of the political noise that happens around those institutions and that affect their functioning, as we saw in the GST Council, but I think as we see with the Constitution itself, the Constitution needs to be to be defended in political practice. Otherwise, constitutions are vulnerable. So, I mean, I think that's where there is a space opening up for opposition parties to start to think about what a kind of serious political platform that tried to take some of these questions of centre-state relations and federalism forward might look like. The Sarkaria Commission. I mean, the Sarkaria Commission report was full of ideas about how you might do these things. So do we need
the Punchi Commission report afterwards? They're fairly far-reaching recommendations.
Yeah, except that nothing was really done with those recommendations of the Punchi Commission.
Thank you so much, Dr. Tillin. We also got on time, 5:30. Thank you so much for sparing time for us, and it was a pleasure talking to you. And I'm sure this would be a great resource even afterwards once you put the video out there. So it's fascinating to hear your research on COVID. And thank you so much for sparing the time and doing the session for us.
Thank you for inviting me and for all those interesting questions. I'll look forward to continuing the conversation.
Yeah, definitely. Thank you.
Thanks.